Have you ever watched the news and found that the newscaster's face looked perfect, but their neck is what aged them? A lot of times this is because of the platysma muscle being overactive. I sure have noticed this. Whoever injected those newscasters skipped the neck when treating them with neuromodulators. That's another reason that facial balancing with neuromodulators can be very effective for many patients. Now, there are certain situations where a patient is very happy with just one treatment area. But other patients, when you calm down one area or one region of the face, other areas may become hyperactive. So if we treat the face effectively with neuromodulators and skip the neck, there's a possibility that we may express ourselves even more from the neck. And as we age, this is a common area that we tend to utilize those muscles a lot. Now that we're getting more and more familiar with treating the neck, I have noticed that there's a lack of consensus on how to treat the neck. Let me clear that up. The platysma is a thin muscle extending from the clavicle region at the pectoralis muscle and anterior deltoid to the lower portion of the mandible and laterally. And this forms the superficial musculo-aponeurotic system, or the SMAS. The platysmal muscle is responsible for movements of the lower lip. It pulls down the modiolus, corners of the mouth, and lower third of the face. It runs contiguous with the DAO and DLI, which is why treating the DAO at the same time as the platysma can be very effective. The risorius runs just superior to the platysma. As we age, our platysmal muscles become more apparent. See? The thoughts behind why those bands become more apparent is because the skin begins to sag due to both skin laxity, and there's also an increase in activity of the platysmal muscle. Surgery can be performed to tighten the skin and the platysma. We can also inject a neuromodulator into the platysma, such as Botox and Dysport, so the tissue retracts just as when our platysma is at rest. It's not going to lift it beyond how our platysma looks at rest. So for a patient coming in and they're there at rest and the tissue is hanging, the platysma is not going to treat that. The bands in the neck can be isolated, so your non-dominant hand can grab a band of the platysma. It's good to have the patient activate that muscle and then grab the band for injection. The way we have patients activate that muscle is by pulling down on their mouth to activate that muscle. Dosing here can vary as well, but it's typically about 10 units a band, and that's for each of the 4 bands. When injecting the face, also known as the Nefertiti lift, it's not as easy to isolate that muscle, and that's because the platysma is covered by a layer of fat here. I see many providers injecting this area very superficially and almost intradermally. And although the platysma is considered a superficial muscle, you still need to get your neuromodulator underneath the fat and into that muscle. So it needs to be deep enough to reach the muscle. And I'll show you an ultrasound image of the face so you can see the muscle underneath the layers of the fat and how deep that is. And so for reference on the face, you need to reach that depth to have an effective treatment. This is why ultrasound is a fantastic tool in identifying the proper depth of injection of neuromodulators. This changes a provider's level of precision by leaps and bounds. There is another concern of over-relaxing this muscle and patients feeling weakness when they try to get their head up in the morning or when performing sit-ups. One effective technique is by not injecting the platysma all the way down, so the lower portion of the platysma can remain activated. This can alleviate the concern for some people. Many providers like to start conservatively for this reason and see how well the patient tolerates it. Do keep in mind that portions of the platysma that you didn't treat may further activate when relaxing one area. If you have the patient wait a couple weeks, sometimes that calms down and you don't have to chase those activated muscles. But do keep that in mind that it's common, and if it doesn't resolve itself within a couple weeks, you can always add a neuromodulator to those areas. This is my personal experience and not medical advice. There is exciting news. Allergan announced in 2023 positive results that they obtained from a phase 3 study in efforts to get Botox FDA approved for treatment of the platysma. But like many areas of the face, we typically perform these areas off-label, and it's standard of practice. With FDA approval, we will have evidence supporting an effective dose for treatment of this area, so I'm very excited about it. What this means is there will be more education in properly treating the platysma. In the meantime, all of you watching and treating, you're all ahead of the game. If you like this video, please like and subscribe and leave a comment of what else you'd like to see.